What we hear, particularly from younger people, is I want a role with purpose and I want a role with flexibility. People can't, well, I can give you that with bells on in social care. In terms of representation as a sector, we are very, very diverse. We are not always inclusive. I think social care has a lot to offer in that neighbourhood space. We see people's health through the lens of their whole lives. We have so much innovation in social care. It's that the system isn't always supporting it. Half of the social care budget is spent on working age adults. Social care is often seen to be women's work, to be unskilled, and it is a highly, highly skilled role. The funding landscape is a bit of a jigsaw of different pots of money with being applied in slightly different ways over slightly different time scales. We attract fewer younger people and we don't keep them. We're hearing stories about our international recruits being subject to hate crimes and abuse and harassment. We're trying to make change happen. The system either needs to be built around the context of the sector as it is, or we need to shift it.
Welcome to Voices of Care. For those of us who support the social care sector and its workforce, there is only one source of wisdom about it, and that is the Skills for Care report that comes out every year. I'm therefore delighted to welcome as my guest today its CEO, the celebrated Professor Oonagh Smyth. Professor Smith, I should call you, but we'll call you Oonagh. I've known you
Of course.
Third time that you're with us. I'm delighted to welcome. Thank you for coming to join us again.
Yeah, really, really happy to. I really enjoy our conversations.
We were supposed to meet before Christmas, and I was going to start actually to look back on 2025, but I wanted to begin actually to, I think, congratulate Skills for Care, because it was an important end of the year in terms of your work and the contract with the department.
Yes, so we have been we're the preferred bidder in the contract for workforce support from the department, which is a 3-year programme to support the social care workforce. We are talking about the contracts now, so things aren't finalised, but we're the preferred bidder, which is excellent news. The social care workforce is so important to us and so important to government and to providers. So we really need to continue to support them.
And it's brilliant because it's over 3 years now in terms of being able to
Certainty.
look forward, etc. And the other big news since we were supposed to meet, of course, is I congratulate you on the CBE that you were awarded for your services to adult social care. It's been such a journey for you.
Thank you. It was a real surprise. It was absolutely lovely to hear, and just so lovely for my team and for social care. Even though my name is on it, I keep saying that this is a recognition of the importance of adult social care, and I'm just the lucky one that gets to get the recognition. It's so important for our sector to feel and to be valued and recognised. So yeah, it was wonderful news.
Well, congratulations again. Talking about the sector to being recognised and being at the centre of policy, I wanted to begin by looking at a bit of the broader policy framework before we go into some of the more detailed things, and also address some of the bigger systemic issues facing social care. We've had the 10-year health plan. We're now seeing parts of that being rolled out around neighbourhoods. Talk to us a little bit, because you've issued a position statement at the end of January, really saying that adult social care is essential for the shift to neighbourhood centres, and I guess you've seen that already in terms of some of the work that's going on the ground.
And this is happening every day anyway. In social care, we are supporting people every day in all of our communities in the most local of areas, and we are completely focused on the health and well-being of the people that we support. Social care is uber local. And incredibly important, that link between health and social care is incredibly important, not for us who work in the system, although it makes it easier, but for the people drawing on care. They don't want to feel the baton change between health and social care. They have one life. I think social care has a lot to offer in that neighbourhood space. We see people's health through the lens of their whole lives, as opposed to seeing people through the lens of a disease. And that's going to be really important as we think more about prevention and personalisation, which is really at the heart of neighbourhoods. So I want social care to be in there as a forceful, equal, positive partner and not an adjunct to the NHS, because we have a lot to teach as well as to learn.
And talking about prevention briefly, we are living in an era of tight budgets, macroeconomically speaking. Politically, that we'll leave that to the politicians to decide. But the issue around this is value for money. On the prevention side, social care's contribution, I think the statistics are quite clear. Early intervention, early investment in adult social care can have multiple multiplier effects in terms of value for money.
And that makes a lot of common sense as well when we think about it. When you build a relationship with somebody, and can I tell us a little short story? I was speaking to a provider, and one of the people they support went into hospital. She had dementia, and she wasn't eating, and the doctors thought that was because of her dementia. That's common in dementia. And the person who supported her, the care worker, said this woman has a huge appetite, even though she's had dementia. There's something else going on here.
Right.
And the doctors were then able to do more exploration, and they found that she had an untreated urinary tract infection that they were able to quite quickly treat. She was able then to be released from hospital quickly. And that comes from the deep knowledge and relationship that we build in social care. And that's just one example that has an impact on somebody's life, which is the most important, but also a saving when you look at the public purse.
And that's multidisciplinary, really, an example of that. And I think one of the things that's come out from your report, which we'll come on to briefly in a moment, but it's clear that social care is now being required to do more complex work. And I wanted to talk again on the value for money. There was a report by the National Audit Office looking at people with frailty, older people. It affects a huge number and potentially costs over £5.8 billion. So again, the social care sector will be required to play a part in much more complex work.
And I think that's absolutely right. When you look at demographic changes that we're expecting, we are expecting a 43% increase in the number of people with dementia by 2040. We are expecting almost a 100% increase of people over the age of 80 by, I think it's 2045. And people have a lot of different health needs, but we know that end of life, frailty and dementia are going to have to be big priorities when we're looking at that population. And people want to stay at home. They want care close to home. They want care close to their family. And that's before we even start to talk about working age adults who are also supported by social care. So that investment in social care, that early investment, that building of community connections is going to be absolutely fundamental for all of us.
And I think those demographics that you're pointing to, I think in the over 65s is a significant jump between now and 2040, 11.5 million to 14.5 million, something like that. Let's touch upon the implications of that for the workforce. Obviously, your report came out some months ago. Required reading for anyone in there. I'm not going to cover everything. Obviously, it's been covered already in the press. But I wanted to look at the workforce side of things in terms of the numbers. The projections are, I think, over the next 15 years, 470,000 new posts. So let's have a look about what the report says, for example, in vacancy rates, because that's been a big problem, but that fell quite significantly to pre-COVID levels.
Yeah. Vacancy rates have been the focus for the last 5 years or so. In last year's report, which covered the year 24-25, we saw a drop in vacancy rates, as you say, to kind of pre-COVID rates,
7%.
so about 7%.
Yeah.
And that equates to about 111,000 posts in any one day. So while that has reduced from previous years, we need to remember that it's still 3 times the national vacancy rate. And when you dig under some of those statistics, we are seeing international recruitment reduce, and we are seeing fewer domestic workers want to work in social care. And so I always encourage us to not look at the bumps, the up and downs in year, but to take a step back and look at the trends
Yep.
and the broader context, because we are going to need to really think about new sources of capacity if we are seeing fewer domestic recruits being attracted to social care and fewer international recruits. It also there's a slightly different story depending on the role. So it's
Yes, yes.
7% across
The whole sector.
the whole
Yeah.
sector. Registered managers have a vacancy rate of about 11.5%. They're such a key post. Personal assistants over 9%, and social workers over 11% as well. Again, a really key post for people. Registered nurses have higher vacancy rates than the NHS. So there's quite a complex story when you dig under the 7% headline.
And actually, talking about what people can do now, providers can do now. Obviously, in the future, there's going to be some policy which we're going to come on to talk about, and it'd be great to get your wisdom on that. But I think what I found fascinating in the report, there are things that can be done now. I think there's the 5 factors. There's a number of things that if providers can focus on that includes pay and 0-hour contracts. But I wanted to hone in on the importance of learning and training. I think despite the fact that numbers have fallen, I think 38% of people having level 2 qualifications, if providers invest in training and education, that can have a hugely positive impact on the retention of staff.
That's absolutely right. I'm delighted that you said it, because it has such an impact. And it also has an impact on attraction.
Yep.
What we hear, particularly from younger people, is I want a role with purpose and I want a role with flexibility. People can't, well, I can give you that with bells on in social care. We just also need to make sure that they can see a career.
Yep.
And they can see how they develop. If you train somebody in social care, they stay. The
Mhm.
more you train them, the longer they stay.
Right.
And so when you look at the factors that impact on retention, you mentioned the 5 factors. 2 of those are related to development. One is training in general, and the other is if somebody has a qualification in social care, they're much less likely to leave. And so investing in somebody's learning and development is really important. We've got the Care Workforce Pathway, which is a really important policy.
2-year anniversary, isn't it? January 24th.
And we're building the roles in it. It's essentially a career framework for roles in social care, which set out the different roles, the competencies, the training that people might need. That's a really good opportunity for providers to really focus on their learning and development. Our early adopters who have put the Care Workforce Pathway into their own practice are telling us they're seeing a significant impact on retention. So that's something new that I think providers can hook into and have a look at.
And in terms of the impact on younger workers, we might have a briefly touch upon that, because their turnover rates are also much higher. And I guess training and offering them a pathway is going to be fundamental in shifting the dial on that.
Yeah. So we attract fewer younger people and we don't keep them. Some of that's really natural. It might be people who are working part-time when they're in university or training, and then they leave to go on to another job. Their career was never in care. Sometimes it's because they try care and they think this isn't for me, and that should be okay. We don't want people to work in social care unless they want to work there. But the King's Fund did a really interesting piece of research looking at younger people in social care, and they also found some quite worrying attitudes in the sector about employing younger people, and some quite poor experiences of our younger staff. And so I think there is definitely, we've got an ageing population in our workforce. We're going to need more younger people in general in terms of numbers, but also in terms of what they bring, different perspectives. And, we're often supporting younger adults, for example.
Yes.
I spoke to a young man who was a care worker supporting a young man with Down syndrome. And he said, I get to play football in the park and go to the cinema and the pub, and somebody pays me to do that. And we don't tell that story enough for younger people, and because they don't always have role models, they don't see themselves in those roles. So I think we could do with much more of a focus on how we both attract and how we keep younger people.
Thank you for that. Taking the broader picture, you mentioned international recruitment. The report has covered that a lot. We had a very significant influx of international workers between, I think, March 22 and March 25, 225,000, something like that. There has been a change in immigration policy. What effect has that had? Because I think that is now de facto a route maybe not open for the sector.
We've already started to see that international recruitment reduce. So in the report on the same period, we went from 105,000 international recruits the year before to 50,000. So it had halved. I want to make the point that people came to work in social care with really good values and are doing an amazing job. We would have really struggled without them. The people we support would really have struggled without them. We're hearing stories about our international recruits being subject to hate crimes and abuse and harassment. It's really, really important that we value and recognise the international recruits that have come over, and particularly now that we stand up for them. And then when we look in the future, there is no doubt that international recruitment is going to be less of a pipeline in terms of capacity. And as we see fewer domestic recruits, we're going to need another source of capacity in the sector. And that is, we need to start talking about that now, because the impact is going to be felt quite soon. So international recruitment is definitely reducing, but I don't want a sense of the kind of sometimes quite some of the really nasty experiences that people have experienced when they're coming to work in social care in a sector where our values are so important to us and our inclusive values are so important to us. So I want to keep championing the people that did come here.
No, absolutely. I think you issued a statement back in September calling this increase in racist abuse out, and I think it's welcome to hear that from yourself. I wanted to keep with the diversity inclusion work in social care. You've been involved with the Workforce Race Equality Standard for social care. I think that was work that began in 2021 with the department to see what local authorities were doing. Tell us a little bit about that, because there's some encouraging signs, but there's also clearly, I think, the propensity to be subject to disciplinary or the representation at management level. There's still work to be done, because I think the most recent analysis included a much larger pool of local authorities.
Yeah, that's absolutely right. So the social care workforce race equality standards, it's something I really feel quite passionately about. It was funded by the department, and then that funding stopped, and Skills for Care has been funding the rollout ever since. Because we think it's such an important conversation to have in social care. Initially, it started with quite a small group of local authorities,
9 or something.
And then it went to 17 and 20.
Yep.
This year, there's 100 local authorities taking part. And that, I think there's 2 points to make there. One, we will have much better data on 100 local authorities, given it's 100 out of 153. But it also shows the level of priority that local authorities are giving to this conversation. The data itself tells some quite worrying stories, and I say that as an organisation who has done the social care res ourselves and have very similar reflections and very similar performance. So I'm not saying this as an organisation sitting in judgment. We have a lot of work to do in Skills for Care. But if we don't have the data and we don't have the safe space for the conversations, then change is much, much harder. And that's what the social care res tries to do. It collects the data, but it also has a safe space for local authorities to learn from each other, to have input, to say, we've tried this, it hasn't worked. We should be able to say that. Otherwise, we're all just trying the same things again and again. Or we've got an incredibly diverse sector in social care overall. So more than 30% of our workforce is from the global majority. Care worker roles, that's close to 50%. Registered nurses, that's close to 50%. So in terms of representation as a sector, we are very, very diverse. We are not always inclusive.
And that's quite a telling distinction. I guess the call is to have the space to have courageous conversations around this. I wanted to, if I may, actually, I know that you've done some work as an organisation yourself to be inclusive, and I think you got a silver award in the talent inclusion
That's right.
and diversity evaluation. So I can see you're leading by example there.
It's been a really important, equality and inclusion has been a really important part of, I was going to say my professional career, but even before that, it's been something that I've always been aware of and concerned about and angry about it often. And I'm a white leader. I have a lot of privilege. I moved to London from Northern Ireland, where it was obviously a very different context. And I was discriminated against because of my religion quite openly, quite often. And I moved to London and I was able to progress. And I always think, would I have had that same experience had I had a different skin colour? Possibly not, probably not. So I think I always try to challenge myself and organisations and create, but also create space for positive change to happen as well. And that's what we try to do in Skills for Care, and that's what we're trying to do with the social care res. Some of these statistics take time to change. Representation rates can take time to change, but representation is just the beginning. The conversations, the deeper change requires us all to keep constant attention, and internally as well as in the spaces that we kind of hold as leaders.
And I thank you for that. I wanted to pick up on that journey of yours. You're clearly passionate about inclusion. You've talked about the discrimination you've suffered. You've also been very keen to give voice to people perhaps who don't have that voice or didn't have that voice around learning disabilities, etc. I think that started obviously in your career. You worked in Northern Ireland Equalities Commission, but I think it started even before that. I think with a personal experience with your elder sister Rita.
Yes, my mum's first child, my sister Rita, was born with spina bifida and didn't live very long. I never met her. I came after, and when she was born, the nurse said to my mother, "Don't name her. Just move on. You'll have other children. You're young." And I remember my mum telling that story, and she completely ignored the advice. We celebrated Rita's birthday. Her birthday was in the summer. Is it the equinox? You call it the longest day of the year. And we always kind of talked about her. All the girls took Rita as our confirmation name, and I think from that, my mum always talked about and recognised people in the community who were disabled. Particularly, I volunteered for a gateway club during my A-levels with adults with a learning disability, and I absolutely loved it. And then fell back at home in Mencap when I was there for about 8 years. I sometimes think in Mencap I used to say this is the final, the kind of final frontier. I'm not sure that is the case anymore. I think some of the progress we've made with equality and inclusion we're going backwards on.
Right.
And so I think we can't be complacent, but that kind of real sense of social justice was built in me very, very early, I think.
And also you've carried that baton to take that fight in all channels, legal channels, we say. You also qualified it with human rights legal experience and expertise, and that's probably helped you in good stead. There's so many quite conflicting legislative initiatives.
Yeah, I did a master's in human rights law. I never practiced it, but I think it gives a really good conceptual framework or an understanding of how things fit together. And I was able to take that into my work in the Equality Commission. And I worked mostly on disability policy. And then when I moved to London, my equalities policy space was much broader. It was across all protected characteristics. But it does, that legal background or discipline gives you space to think through, well, how do I make some of this change happen? And it brings concepts into your awareness that you mightn't have before. It helps you to be more aware of language as well. And I don't think I would have been very good in the practice, but I think I've benefited a lot from the learning.
Well, the passion shines through every time that we've met. I wanted to step back now. We've talked about some of the detail, the minutiae, which is extremely important, and take this opportunity of you joining us to actually take maybe a bigger picture with social care. There's lots of initiatives that are coming up. But look at some of the more systemic challenges, because these challenges in social care have been here for a long time. And I know that you've thought very deeply about actually what are the big issues that we can tackle, all of us, to help social care get some of the change that it's crying out for, and ultimately to help the people who receive services live gloriously ordinary lives, to use that wonderful phrase. I think one of the first things is to ensure that there's better understanding of what the social care sector does. There's still work to be done there, isn't there?
So much work to be done. All of the research, even since COVID, shows that the public don't really understand social care. They don't understand the funding. A lot of people still think it's free at the point of need. Social care is often seen to be women's work,
Yep.
to be unskilled. And it is a highly, highly skilled role that I don't think that's understood. When we speak to care workers and people working in social care, 50% of them tell us that they feel undervalued. And even despite all of that, people in social care stay in social care longer than they stay in other similarly paid roles. And that's because they are driven by purpose and they are driven by a kind of broader values base. But it does explain some of the reason why social care hasn't been a top political priority in the past. If the public don't understand it, that often then translates into politicians not understanding or prioritising it. So I think there is a lot of work to do, both in terms of the actual understanding, but also the value.
I guess one at a tangent on that would be the fact that actually social care, yes, highly skilled, lots of complexity now, growing complexity. And the other cohort that isn't often associated, or perhaps more now because of the work that you've done, is the ubiquity of nursing in social care. I think the report showed numbers had jumped back up to something like 35,000, and they dropped a couple of years earlier down even as low as 31,000.
Yeah, and that's a lot of that additional capacity was international recruitment. So thank you so much to our international recruits, because it's such an important role, and I don't think people see it or understand it. I also think social care is often associated with older people, and that's a really important part of what we do. But half of the social care budget is spent on working age adults, and that is a part of the sector that the public, I think, would be surprised to even hear that. We used to say in Mencap, we want people to live in ordinary homes in ordinary streets, and that is that's really important for individuals. It can make social care less visible, and that is the right thing. I don't want people to know what is happening in my house, but it means that social care isn't any one thing. It's a lot of different things for a lot of different individuals. Health is the same. Health is very complex, but people understand the brand of the NHS. So I do think that we have more of a job to do politically, but then also, won't that help attraction if people understand and value social care more, particularly as we're in the world of AI. I saw an ad on the tube a while ago saying, I can't remember what sector it was, but this is an AI proof sector, and I thought, well, so are we. Not that we won't use AI, but we will always need people building actual relationships, and let's talk about that more.
So the advocacy piece about the sector is one of the systemic issues that you're calling out. I think the other one that you've talked about is the NHS. Of course, every trust is local, but it's governed in a particular way. The policy levers for social care, you've got ICSs, ICBs going into clusters. We've got local authority. So that's also an issue. How do we address that? Because that's quite entrenched.
Yeah. And this is one of the reasons that we worked on the adult social care workforce strategy. We have 153 local authorities, 42 ICSs that are going to reduce, 19,000 providers. We've got a number of government departments, depending on the policy area, but two main government departments in social care, Home Office. We've got a number of regulators, a number of professional bodies. If they're all pulling in different directions, pulling different levers, possibly against each other, then it's very difficult to make change happen. It doesn't mean that you need one lever,
Yep.
but it does help when you've got one unified strategy where we are all saying, these are our priorities. Over time, I'm going to make change in my space that's heading in that direction. If you're going to make change in your space that's heading in that direction, that's going to make more impact. And so aligning those levers is really, really important, particularly locally. We need the national space to set the conditions for people to act locally. And so having that joint strategy and people pulling in the same direction is really, really important.
Yeah, and you've called the strategy, which you've of course led, now into, I think, second year now.
Well,
Is there so many recommendations? I think the 56 originally have been taken up. A once in a generation opportunity. Just briefly tying that, we're expecting a 10-year health plan, workforce plan, forgive me, for the NHS. So it's quite a timely call from your perspective.
I think that's absolutely right. The 10-year health workforce plan will touch on social care, of course, particularly when we look at neighbourhoods, but also nurses, some of those really important roles. The workforce plan that we did with the sector, I think there's two things about it that are really important. The content of the recommendations and the evidence is obviously really important. But it's also the process of bringing people together to align and agree joint priorities, because the content will shift. If the policy priorities in the NHS, for example, change, or government sets different policy priorities, we need to be able to change the strategy to say, well, how are we heading in this direction? But building the space, building the evidence, building the relationship and the mechanisms to join together is equally as important. And that's what we've tried to do with the workforce strategy. Hopefully we will see a social care equivalent of the health workforce plan, which will link with the strategy that we've worked on. I think there's a lot of alignment with what the sector is saying we think needs to happen with the workforce and government priorities. When you look at the Fair Pay Agreement, when you look at the Care Workforce Pathway, a lot of the other policy initiatives, we're saying the same thing. That's wonderful. There's a lot that we can do there. It takes time to see change, but the more that we can all join together and agree what those priorities are, I think that's where you see change actually happen.
Well, let's wait and see when that comes out. We've talked about those two big areas of systemic change, what the public knowledge, policy levers. Let's go to the people and the providers for the last two. So there you've identified. So the workforce, obviously, pay, funding. This is a complex area as well, because funding, you've got the Better Care Fund, you have continuing care. There have been calls from some organisations in social care for commissioning funding to be taken out of local authority control. I'm not asking you to comment on that, but in terms of the funding framework, that has to be simplified, doesn't it?
This is what we hear from providers all of the time, and local authorities. The funding landscape is a bit of a jigsaw of different pots of money with being applied in slightly different ways over slightly different timescales. And I think that does create a confusing landscape. It's quite hard for providers to plan long term. That's what they tell us. Particularly when we're looking at the need for capital investment, for investment in any transformation, they will often hold off doing that because they don't have the certainty of funding, because some funding short term. And so I do think that Baroness Casey in her review, I do think is probably going to look at the funding landscape. I'd be surprised if they didn't, but it's a really important point. It's quite we can all talk about the need for a strategy and a more strategic approach. It's harder to do when you're trying to make long-term change with short-term money.
Absolutely. And actually related to that also is the other point I wanted to pick up, systemic issue that you've written about, and that's the fragmentation in the market. We're not commenting on a value judgment. It's what effect that has on the ground. I think something like 84% of providers might be less than 50 employees. Micro providers around 37. That's 4 people. And the CQC in their report at the end of last year did highlight, and there's an imperative. There is a legal framework, putting your legal hat on, where local authorities are invited to shape the market. So there's a large number of very small providers. Is that an issue that continues to affect how social care develops and evolves?
So we now have 19,000 organisations in social care, and that is an increase of 500 in 1 year, March 24 to April 24 to March 25. So 500 net new organisations. We, as you say, 37% of those employ between 1 and 4 people. 85% employ fewer than 50, and then 2% of our providers employ almost half the workforce.
Right.
And so we have a lot of micro providers and a small number of very large providers. I think we need to get better at recognising in social care, where do we have helpful diversification and choice for people? Because we really do need to think about personalisation. So when is it helpful diversification, and when is it unhelpful fragmentation? And what we hear from some particularly smaller providers is we can't get enough, particularly in home care, we can't get enough hours to bring together enough staff to keep them, or we can't get enough hours to be viable. So we have work spread among a large number of providers. It also means that where we're trying to make change happen, the system either needs to be built around the context of the sector as it is, or we need to shift it. So, for example, if we have 500 net new providers, not all of those will be CQC regulated, of course, but a lot of them will be. And so what does that mean for the resource that we have in regulation? Can we expect our regulator with the same level of resource to keep regulating a growing and growing and growing number of providers? How does that work? Or how do we have a different conversation then to say, if we think that this context of diversity is important in the sector, we're probably going to need to design the system differently in order to support it. So I think we just need to have a more explicit conversation about the choices that we're making. I also think what we see is a lot of innovation in social care. We talk about we need more innovation in social care. We have so much innovation in social care. It's that the system isn't always supporting it. What we rely on is excellent leadership, pushing through with innovation, almost sometimes in spite of the system, which makes it harder to scale that innovation in any significant way. And that is often the way that the system works, and the number of providers, and the number of local authorities, and the lack of kind of shared direction, I think.
If that's, despite all of these systemic issues, a sector that's contributing towards £80 billion of gross value add, imagine what the sector could do if we addressed some of those things. One final element, and no doubt Baroness Casey will be addressing, as you said, a number of those points. I want to end with a little bit of a future look. What are the priorities for you and Skills for Care for the rest of the year? We've got some important policy pronouncements coming, the 10-year workforce plan, Casey. But your spotlight at the moment is very focused on the learning and development point around driving the agenda for training and qualifications as well.
Yeah, it's such a fundamental part of what we do. The skills landscape at the national policy level is changing quite a lot, and we want social care to be in there, prioritised, and it is one of the priorities for Skills England, so I think that's excellent. The local skills improvement partnerships, we're working with all of those to support social care to be a priority. So that kind of skills focus is going to be really important. There's quite a lot in the employment rights space. So the Employment Rights Bill, this is a sector that makes up almost 6% of all roles in England. It's a big sector. And so any broad labour market changes will have a huge impact on social care. The Fair Pay Agreement, obviously the KC review. So there's a lot in the policy space that will be drawing our attention to. The social care strategy will be a big priority, and the social care res, particularly, I think now that we've got 100 local authorities, that's such rich data and information, and we need to be using our kind of voice to have conversations about how we become and how we are more inclusive as a sector, both because it's the right thing to do, but also because it helps retention. If we are and attraction, if we are known as the most inclusive sector to work in, wouldn't that be fantastic? So a lot of priorities.
And you got a pay report coming out just to finish off, so it's people to look out for.
Yeah, our data and the reports that we release are so important. They're such a fundamental part of what we do. We've got a pay report that's coming out in the springtime, and then we've got our size and structure report, which usually comes out in July, and that will be the updated vacancy rates, so that really important figure. And then our big report, the State of the Adult Social Care Workforce in England, will come out in October as usual. We update a lot of our stats monthly, so that's all available on our website, so you can see the trajectory, and then those big reports take a much more of a step back. They're much more statistically reliable because they're over a longer period, and they look at the trends, so they're incredibly important, I think, to shape our policy direction.
And would love you to come back again and talk with all of the developments that we're going to see over 2026. But for today, Oonagh Smyth, thank you so much for coming and sharing your wisdom with us.
Thank you. My absolute pleasure.
Pleasure. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to learn about how we are turning the dial on the health and social care debate, please visit www.voicesofcare.com. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next episode. I think that's